So I'll thank you, Derek, for that lovely, warm introduction. I definitely remember you now, and I shan't forget. I was really interested, so I was sat at my desk at South West London and St George's, and an email popped in from Jane saying, would I be willing to join her to talk today about women in leadership? Well, I didn't really think too much about what I was going to say at that stage. The only thing I knew was that it was more important for me to stand alongside Jane and be with her than it was about what I was going to say. I'm incredibly proud of being a director of nursing. I'm particularly proud of being a director of nursing in a trust that I trained in. I guess that the comment that was made in the previous talk around why do I do it because I want to make a difference. But I guess I do it as well because sitting on the board, you have a greater degree of influence to make and take decisions, and sometimes that can feel really frightening. And one of the things that makes a really big difference to me is that I know, because of the relationships across the South London Partnership and with my fellow other directors of nursing, that I'm not on my own in making and taking those decisions. So on my journey here today, Beverly Murphy, who's the Director of Nursing from SLAM, who would have loved to have joined us, phoned me. She was in the middle of another meeting, but she wanted to find out about the psychiatric decision unit we've made, and just shortcutted everything, and we were able to share very quickly. And at the end of the call, after she'd gleaned the information she wanted and was then going to move on, I said, what message would she give to women in leadership here today? And her phrase was, well, we just need to get on with it. I'm not sure how helpful that was, but I thought I'd share it. So I guess part of why we set the nursing development programme up across the London Partnership, I have to be really honest, it wasn't about women in leadership. I think we set it up because there were some really wicked challenges that we have within nursing, and that actually each trust was trying to solve individually. And we were spending hours worth of brain time. And it was a comment that Maggie made, who works in Oxleas. And she said, well, we're all trying to say the same thing, we just need to get on and do it together, because it's going to save huge amounts of time. And through that, what we've been able to do is get some real momentum. So one question, what's the percentage of women who train to be nurses, do you think, compared to men? Breakdown. Pardon? 89%. 89% of the nursing workforce is, you think? Yeah. 89% of the nursing workforce is female, although on all the stats it's put up about how many men don't train to be nurses. So only 11% of men choose. And we haven't managed to shift that statistic for the last, I think it's the last 10 years. That stat hasn't changed. But when you look at the earning of nurses, women are still earning 14% less than men in 2016, and only make up a third of the more senior roles, which I was really surprised by. I don't necessarily recognise that, but that's what the stats tell us. And I think through the work that we're doing in the South London Partnership and the Nursing Development Programme and the talk that Jane's going to move on to, I think we can make a real shift in getting those numbers and the balance more evenly distributed.
Thank you. Can everyone hear me okay? No. Can everyone hear me now? Yeah. Now? Yes? Good, yeah. I was waiting for the echo. Thank you, Vanessa. I'd really like to echo everything that Vanessa has said. It's an absolute privilege to be able to work with such inspirational and motivating women as herself and Beverly. And we really are enjoying what we're being able to do together for our nurses and our service users across the South London Partnership. We really are better together, and collaboration and competition really, really works. And I'm hoping that I can share some of the things that we have achieved so far for nurses with you, which will demonstrate what these opportunities give us. Now, I remember writing an essay in 1988, which was arguing why 90% of nurses are women, but only 10% of get into the jobs that they want to do, whereas 10% of the men going into nursing, 90% of them get into the top jobs. Things haven't changed, and we're going back a long way here. But what we're trying to do is make sure that we are giving opportunities to all nurses. Because when people come into the profession to be nurses, they come in because they are caring, they're compassionate, they're helpful, they're driven, and they work really, really hard, regardless of whether they're male or female. But we want to make sure people have the opportunities to have fantastic, flourishing careers, and we want to help nurture that. So in terms of the South London Partnership Nurse Development Programme, I'm just going to touch a little bit on the who, what, where, why and how, and then we'll give you some examples of this. So I'm sure that throughout the day we've really reinforced who South London Partnership are. The three organisations working together, bringing their clinical expertise, their clinical appetite and their passion to make things better together. And we really do cover a huge geographical area, as well as having a population of over 3 million, and goodness knows how many boroughs, and working in partnership with boroughs, let alone each other, is a challenge. We actually have well over 5,000 nurses. So when we consult or we represent or we speak with, we are having to work really, really hard at a huge number of professions. And whilst we're predominantly here talking about mental health today, within nursing, mental health touches absolutely every field of nursing. So I stand here today confident that South London Partnership are influencing nursing practice in health visiting, children's nursing, prison healthcare, learning disabilities, and I could probably go on. But we really are making a big difference. So what we wanted to do as part of the Nurse Development Unit was really combine our buying power and our thinking power. Vanessa touched on our colleague Maggie Granger's comment that we're all trying to crack the same nut. And by doing this together, we have managed to get a lot of support from Health Education England, and this comes with money, it comes with a belief in our abilities to do things, and we're really creating a workforce south of the river that we would like to think is the envy of the rest of the country. Certainly better than north of the river. So, why are we making these changes? Well, last year, really, really sadly, for the first time, more nurses left the NMC register than they joined it. Most of us in this room joined the NHSI retention programme, and most of us have had to work really hard on recruitment and retention. For our Band 5 nurses in all fields, we lose a third of them in the first year and a third of them in the second year. Sometimes they're moving to different organisations, but some of them actually leave nursing. Some of them find that it's less stressful and just as financially rewarding to work in Aldi's and Lidl's. And these are some of the biggest barriers that we've had to try and manage, because we know when people come into nursing, they desperately and passionately want to be great nurses, and they really, really want to make a difference to people's lives. And this is what our career programme is all about. In addition to this, we've also had to look at the perceptions of nursing nationally, and we've had new challenges, Brexit, for example, coming in. And there's been a plethora of different workforce initiatives over the last 10 to 15 years, but none of them have really prepared us for the changes in nurse education that are happening now, with the apprenticeship routes, with the bursaries going, different routes into nursing. So workforce is not planned for where we are. We now have some major challenges. We've got huge vacancies, and we have a very ageing workforce, and we have some changing population health needs. There's a real focus on prevention, but we know that many more people are living longer with many more comorbidities. And this is having a real impact on how we are running our services. And we've yet to get that confidence in our new training that our nurses coming through the new ways of learning are going to be skilled up enough and empowered to deliver. So whilst we're delivering the programme, we're really, really working hard to make sure that we are training and providing the learning environments for the new people coming in, our new roles, our trainee nursing associates, our assistant practitioners, and people coming in doing degree programmes and apprenticeships. So the aim of our programme was really to help all staff reach their potential. We didn't just look at the retention. We have increased our stability index in nursing, but we still have high turnover. But what we wanted to do was look at the workforce and develop the skills and the competencies in all of the nurses. And we have achieved over the first year a fantastic, clear nursing framework from apprenticeship level now, Band 2, right up to Band 7. We have consulted and delivered a mind-blowingly ambitious programme to standardise all the job descriptions across 3 organisations with competency frameworks. And we have introduced both the assistant practitioner roles and trainee nursing associates. We're actually aiming to get another 100 training nursing associates in for the 1st of January. Touch wood, we are going to do this. And we have now introduced an employee passport to make it much easier for our nurses to move across the 3 organisations so that they can get a variety of different skills and experiences. And if they want to move out of one place, we don't have a sense of loss. Actually, we're keeping our nurses in SLP. It's a really positive move. So this is what our career pathway looks like. There's a lot of information that goes behind it. But you can see if you come in as a healthcare support worker, how you can move into a more senior role, how you can develop into a nursing associate, onto your nursing, and then what advanced clinical practice looks like. In our second year of the programme now, we're really pushing the boundaries for that advancing practice. So what we're now looking at is leadership and development for those nurses who are at Band 6 and above. Exciting opportunities in community, bringing in new roles and new bandings. I've talked about the nursing associates, and I'm going to touch a little bit more on that later, but for reasons that will become clear, I'm going to leave that one for now. We make moving around easier, and we've had some really successful campaigns together. One recently around CAMS. We had a Saturday where we had over 80 people came. Really, really excited about the opportunities that we could have, and we recruited a lot of staff to some pretty hard to fill posts. So, you're not going to be able to read this, but Vanessa and I are going to do a double act here. We've got a couple of case studies for you, just to bring to life what it's like to be on our programme. So our first case study is about a nurse called Sinead. Sinead is well on the way to her mental health nursing degree thanks to the funding of her professional development from the South London Mental Health and Community Partnership Nursing Development Programme.
Okay. It's a really important, positive thing to offer all staff. I don't think I would have been able to fund the degree myself.
Sinead, a Band 6 community psychiatric nurse in South West London and St George's, a community team, completed her diploma in mental health nursing in 2012. She worked for SLAM in an inpatient setting before moving to a community team.
I'm already using some of the learnings, for example, working with substance misuse. In my practice in the workplace, there's also really useful emphasis on physical health and its relevance. Another benefit is that I can share my new knowledge with the team. So Sinead has already completed modules in substance misuse and evidence-based practice and is currently studying medical management for psychosis, highly relevant to her work in clozapine clinics. She usually spends 1 day a week at university alongside self-study and will research and complete a dissertation as part of the course. it is quite a commitment alongside my work, but it's really adding to my experience and skills. Having a degree will also help me in progressing further my career. Investing in my education gives a really positive message that you want to retain and develop people.
Sinead's actually one of about 18 people that we funded onto their BSc or their MSc, and it's the continuing professional development funds that have really dried up for nurses over the last few years, and being able to put this many people on who can then have peer support and progress their careers together has been really, really rewarding. Now we have one more case study, and you might recognise from the picture that this is Ruth. Ruth is one of our very own Oxleas trainee and nursing associates. She came in as what we called the pilot phase. This was the fast track followers. And Ruth's kindly come along today to share her story and her experiences. So I'm going to hand over to Ruth in a second, and I'm sure that she will inspire you.
Thank you very much. That's not me, please, actually. Can you all hear me, or would you prefer if I use the mic? Use the mic, okay. Before I start, I just wanted to say I feel both honoured and humbled to be asked to speak here today, particularly after today's very eminent speakers. But a bit about me. My name is Ruth, and I am part of the second wave of trainee nursing associates. This post was brought in to bridge the gap between first level nurses and healthcare assistants. I'm 6 months from the finish, so a year and a half down the road. But my background is I left Dublin 30 years ago and arrived in London and began working for what has now grown into Oxleas NHS Foundation Trust. I've worked both in the public and private health sector, but predominantly in the NHS. I left school with no formal education, and instead of and have dipped my toes into other training routes such as MBQs and care certificates. For me, unfortunately, timing, finances and opportunities and self-belief never really aligned over the years. This course was highlighted to me by a placements manager within Oxleas, the great Vicky Smith. But also, Geraldine, with a nod to you this morning, you asked us to pick role models, and the one that I always refer to it has been the consultant in the team that I work for. She's sitting here, and I'd love to really embarrass her further, but I'd probably better not. I didn't really want to do this course, if I'm really honest with you. I was very comfortable in the role that I was in, and I was quite confident, and I loved the job that I was doing. It's very difficult to leave the comfort zone, but the consultants that I worked for then gave me a swift injection of shoe leather and said, "Get a grip, woman." So here I am. So I had a lot of autonomy in that team. So leaving that team to go into study and push myself outside that comfort zone was extremely difficult for me. I'm sorry, I've really lost my place. The program, it's a 2-year. The reason that I did eventually go to the course is it's a 2-year work-based course, which enabled me to actually work and continue to pay the mortgage. At my time of life, I'm coming more towards the end of my career than I am at the beginning of the career. So without the funding from Oxleas, there was no way I would have been able to do this course. The programme is designed to enable qualified nursing associates to work within all aspects of nursing, alongside but under the direction of the first level nurse. It's a generic role across the lifespan. And I'm very proud to say that on Wednesday I was actually at the NMC General Council meeting where they signed off the standards of proficiency for nursing associates. So we have our own set of standards and proficiencies. At the end of our training, we will have our own PIN number and we will be accountable for our own practice. So it's quite... It's quite groundbreaking, and I've got to say I'm very, very proud to be part of this, what I feel is quite a momentous and historic moment within the NHS. Yeah, I think I'm just running out of things to say now.
Thank you, Ruth. Ruth's very humble. She's been an amazing person to work with, and actually sharing her journey has been inspirational. Before we finish, I just want to take Ruth back, which is a bit of a surprise for her, to a couple of flip charts that she drew when she was really early on her journey with some colleagues, and just ask for her reflections on them.
So these were right at the very beginning of when all of the trainee nursing associates started. We were asked to, I suppose, quantify it, to put into words how we felt at the beginning of our journey. And I've got another colleague, another student colleague here with me today, and I think, Shanna, you actually drew this. And these were some of the words and the terminology that we were using. Things like we felt passionate, we felt hopeful, job satisfaction, and accountability. These are all terminology that we were using at the beginning of our journey. And again, these are just more terminology that we had used. Commitment, we were all very committed. In fact, I think we've had a very low dropout rate from the course compared to student nurses, actually. There's been quite a high rate of dedication and determination from the trainee nursing associates. So, thank you very much.
Thank you. I'm sure you'll wish Ruth and her colleagues the best of luck for their future careers. They're going to be amazing. They're just an example of what we're delivering in terms of working together as partners for nursing and the profession across London. Thank you very much for listening.